Hey everyone, welcome back to another video. In this video, I will be going over what I do and what it looks like to work in the emergency department as a registered nurse. In this channel, I aim to provide more information about the nursing profession and share my nursing knowledge to help others. If that interests you, please consider subscribing and giving this video a thumbs up. I would greatly appreciate that. Now, this is not going to be a vlog style video, as I do not want to record videos at work, especially during a pandemic. Instead, I'm going to narrate and explain what the shift is typically like for 12 hours. So I start my shift at 7:30 by looking at the assignment I have been placed into. In the emergency department, there are 5 different places that I can be assigned to work in. The 5 areas are first aid, intake, acute, trauma, and triage. If you want to learn more about the differences, check out my other videos or my emergency nursing playlist in my channel. Typically, since I'm not trained to work in triage or trauma, I work in the acute or intake section of the emergency department. In today's example, I'll talk about the acute section. In acute, I'm responsible for 4 beds, which means 4 patients. So I start my shift getting report on the patients in the beds and their plan. It is typical in the ED that I do not have patients occupied in all my beds. This is because the goal of the ED is to diagnose, somewhat stabilize, and get them up onto the appropriate floors they belong to. However, due to the logistical reasons, this does not happen every time. Anyways, the day starts by identifying the sickest or the least stable person I have to take care of. Sometimes that means a patient that is in active chest pain, in a dysrhythmia, has pancreatitis, or someone who is manic and is on 4-point restraints. So I start by doing a primary assessment and a focus assessment on what they are here for. Then I document my findings and make sure I have vital signs that are done routinely. In the ED, you don't always have orders. That does not mean you do not do it. You take responsibility of the things based on need. Typically, this means that you're doing vital signs every hour or 2 and having them on telemetry. Just better to be safe than to not, or to miss something. After I do my assessment and documentation, it is time to look at medications and see if it is appropriate to give them. Orders can often be duplicated or mistakes are commonly made by the prescribing physician. Therefore, it is even more important in the ED to do the safety checks. It is common for orders to be duplicated because the patient is on regular medications at home, and so when they present to the ED, the physician does not know if they have taken their regular medication and consequently orders them again. So new admissions, it is typical for a patient to be brought in within the first few hours of coming in. The patient is often brought by the ambulance, but there's a chance it is brought from trauma or intake. Regardless, it is your job to do a thorough assessment utilizing the emergency department assessment framework we learned in school and identify areas where there needs to be further investigation. Interventions you provide as a nurse are based on what you think may be the reason they're here. Is it an infection? Obtain a urine specimen and dip it. If it is pneumonia, check for adventitious sounds or ask if they have a productive cough. Depending on the reason they are here, it may be necessary for the nurse to provide intervention before the physician is able to have the time to see the patient. In addition, it is up to the nurse's judgment to see if the physician needs to see the patient right away or not. In the emergency department, nursing-initiated actions are very common, and the scope is based on the culture of the emergency department. This is all done while I'm caring for the patients this is all done while I'm caring for the patients I already have. Once all this is done, I go on a 30-minute break in the morning from 7:30 to 12:30. I come back on break, making sure vital signs are done and there has been progression on their journey in their stay at the emergency department. Are they needing a physician to reassess them? Have they come back from medical imaging and the results have been reported and we just need a physician to take a look at the report? Or do they need to have social work, physiotherapy, or occupational therapy consult in order to safely discharge them from the hospital? This is a constant thought you have as the day goes by, on top of making sure the patients are essentially not dying. So by now, a patient is often discharged or sent upstairs to a floor for further interventions or investigation. Essentially, a patient has typically left one of the 4 beds you're in charge of, and now it is time to receive the next one. The cycle of admission and discharges continues until the end of the day, at which point the night nurse shows up and takes care of the 4 beds you were assigned to. So this is the end of this video. I wanted to share what it is like in the acute beds to give my friends and family of an idea of what it's like being an emergency department nurse, as I always get asked. Hopefully this clarifies, and maybe if enough people like the video, I will explain what it is like working in other sections of the emergency department. If you enjoyed this video, please consider giving it a thumbs up. Thank you so much for watching, and I will catch you in the next video.